what I mean by that, in this case, when you had immunity down, and because of that your weakened immunity, the virus was able to be stronger in your body, leading to various signs and symptoms. But now what we did, we developed some drugs to arrest the virus. And what was our intention? Our immunity, which was decreased, we tried to bring it back to the normal. Or because of the viral load, the immunity went down. Now you kill viruses and try to bring normalcy. It is moving, right?
Is it not? Yes, yes. Safety, efficacy, learning.
Yes. So I was still on the same.
Yes. You were in basic definitions.
Yes. Okay, now you can see the safety efficacy slide?
Yes, sir. Yes.
So now, when we are developing drugs, for all the students and faculty who are attending this talk, I would want you to understand last slide and this slide so meticulously. If you understand these people, you are already an exceptional scientist. As I said, be it a vaccine or a drug, what do we always think about? What is your target disease? Right? Say I just gave you an example of COVID-19. Let us take the same example so that we can connect the dots. Then, in COVID-19, what was our target population? The target population in COVID-19 was pediatric patients, including geriatric patients. So that became our target population. So now, in the previous slide where I showed to you how complex is the drug development process, right from the basic to the non-clinical to clinical. So once you have identified your target disease and target population, you will start developing the drug as I explained it to you in the previous slide. So what, as a scientist, you would always want two characteristics of your drug. One is the drug has to be safe. Do you agree with me? If the drug is not safe, you will never take it, or no regulator will approve it for its utility. But is it sufficient that drug is safe, that is enough? I think no. The drug has to be efficacious. Having only drug is safe but it is not effective, it is of no use for you. So therefore, the drug has to have an important quality called as efficacy. To give you an example for COVID-19, as I said, unless your drug is not able to kill the viruses, it is not effective. But if it is safe, it is not used to it. So there has to be a balance between efficacy and safety. Right? So, as you are developing drugs, and as I told you, you have identified your target disease, target population, you conducted safety animal studies, you conducted efficacy studies, and now, for in every experiment, what you are doing, you are learning, and whatever you have learned, you are repeating it, right? And that's what we call it as a confirming. Because you always repeat the experiment at least 3 times or at least in twice. So in each experiment you will learn something, and when you repeat it, you will confirm your observation. And while it is happening, suppose you have been successful connecting these dots, and when you go to the regulator, that is USFDA or DCGI, there you would want, or the DCGI or FDA would assess the benefit risk ratio of your product which you have developed. So benefit is nothing but the efficacy, right? If it is effective, then you will say yes, it is benefiting my patient. And why? What is the risk? Risk talks about safety. So it is the ratio of what is the benefit versus the risk ratio. If the benefit outweighs the risk, then yes, the drug can be approved for use in humans. So if you understand this slide very clearly, I believe you can connect these dots to anything what you are learning as far as drug development is concerned. So I have changed the slide. Can you see the slide now?
Yes, sir. Is it one size fits all approach?
Yes.
Yes, sir. It's visible.
Yes, good. Now, let us what I did until now in last 10 slides, I gave you an idea about drug development, why you have to drug develop, why you have to develop drug, because there are not many drugs, no cures available, and I walk you through the steps involved in the process of drug development and the safety, efficacy, and risk-benefit paradigm or structure how you have to pay attention to. Now we'll talk about precision medicine. That is the context of your conference for which you all have gathered. And now I don't need to tell you what is precision medicine, right? Because you have been listening about it since yesterday. Precision, it is also called as personalized medicine. Now, it is in simple word, you are making it as personalized treatment available to a specific A patient, or it's me. Suppose I have got a specific rare disease and you are an innovator, you would say Dr. Jadhav has got a specific rare disease for which this is your new innovation, and you feel that that would help me get the right drug in the right dosage form at right time so that my signs and symptoms can be improved. But while doing so, especially for precision medicine, what are the key factors which one has to understand while you are utilizing this approach? One is genetic factor, and one environmental factor, and lifestyle differences among individuals. So, therefore, personalized medicine plays or has been considered to be an important approach to drug development, where you are treating the a specific population of patients or a single patient for treating for a specific disease condition. I think this slide would be very interesting for you. I changed the slide. I hope you can see it now. If I give you a historical perspective, in 1998, US FDA approved a drug called as Herceptin. I will tell you a very interesting story about this drug in coming slides. But I just want to give you some glimpses how the precision medicine discipline has evolved since 1998. Now it